This is the KBIT-2 Revised video series. I'm Tina Eichstadt, Senior Product Manager at Pearson. Our episode today is with clinical psychologist Dr. Jenny Singer, who also happens to be the daughter of Drs. Ellen and Nadine Kaufman, the authors of the KBIT-2 Revised. Welcome, Dr. Singer.
Thank you. Nice to be here.
So let's talk a little bit about your views of all the uses and applications of the KBIT-2 Revised. What has been your experience with using the KBIT in your practice?
I've had a lot of different opportunities to use it and to see it used. One really important one is when you're testing a child or adolescent for either ADHD, ASD, or LD, and they've just had like a full cognitive battery within the last 6 to 8 months, and you just don't have any interest in that, but you need that new cognitive portion. And the KBIT-2R works really well for that. Sometimes you might be doing like an ADHD assessment and you just don't need a full cognitive because the child is having no issues. Maybe they're getting straight A's. You don't need to worry about the full cognitive, and it just helps to be able to do it quicker, and it's reliable and valid, which is really nice. Another reason is if you're doing a battery over telehealth, there's no manipulatives. It's super easy to be able to get both the verbal and nonverbal information right over your computer, and it's super easy. Sometimes you're just limited by distance and you just absolutely can't do a full, cognitive test. And this gives you a reliable and valid information, verbal and nonverbal, and that's really helpful. Something that I use it a lot for is a forensic population, because generally I have limited amount of time. I don't generally need a full cognitive battery, but I really need to know what their verbal and nonverbal skills are for the judge if I want to recommend treatment. And so I really appreciate that. And also most of my forensic clients are online. And so again, I can do the whole battery in an online situation. And I guess finally, if you're working with older individuals and you need to determine mental capacity or some kind of a judgment for them, this is a perfect way to be able to get that information. And the KBIT-2R is normed all the way up to the older age. And that's really the only way you're going to get that.
That's great. It really sounds, Dr. Singer, like you've used the KBIT in a variety of ways and really see the flexibility of what this particular measurement tool offers you. What counsel or advice would you give to colleagues that may be considering using the KBIT-2 Revised?
Well, I guess if they are in a practice where they need more than a full battery, or they find themselves needing to be a little bit more flexible, such as if they are doing online assessments, or if they're working with, different types of populations. I just think it's a natural for like a nursing home population. I know there's a lot of work there, or if you're working with forensics, or just simply if you do a lot of online assessment, I think it's just necessary to have in your toolbox.
That's great. Thank you so much for your time and insight today, Dr. Singer. And for all of you who are listening, more to come on future episodes of the KBIT-2 Revised video series. Thanks for watching. Have a great day.